Hi, welcome to the Biomarker Decoded series with me, Dr. Ara Supaya. A little bit about me. I am an allopathic physician, also trained in functional medicine, acupuncture, culinary medicine, sports science, biomechanics, strength and conditioning, whole variety of things. But the purpose of this series is to talk about biomarkers when it comes to assessing athletic performance. So, what are biomarkers? Biomarkers are these biological molecules that are found in tissue. That tissue could be blood, could be urine, stool, hair, saliva, right? These are the common ones. And these biomarkers give us an insight to what's going on internally, just like your dashboard in your car, right? It gives you a rundown on so many things, so many different parameters. The trick is to know how to interpret the data and when to look at the data. So I'm going to use this series to kind of introduce you to the concept of biomarkers, specifically when it comes to athletic performance. For the last 25 years, I've had the privilege of working with some of the most elite professional athletes on the planet, mostly in golf, right? 7 world number ones. And I've accumulated data on all of these people. So males, females, different age groups, and more importantly, I'm able to look at how their bodies look at different stages of the season, particularly the off season, mid season, and then end of season. And that gives me this incredible insight when I put that on the background of the amount of travel they have, the amount of illnesses they've had, allergies, and their success. Were they playing well? Were they not playing well? And so that database allowed me to come up with a framework to assess athletes using biomarkers. Okay. Now, you don't necessarily need biomarkers. There's a lot of information to be gained by just talking to an athlete, asking them very specific questions, right? Their mood, their perceived energy levels, how well they slept, do they have muscle soreness? Those are very, very good indicators if you can trust the athlete to tell you the truth. Now, if you work with my group of athletes, they all want to train harder. They all want to do more. So they'll tell me exactly what I need to hear, right? These are the best athletes in the world competing for tiny edges. So, their modalities go harder, right? And then nowadays, you can also look at wearable data. So these are Oura Rings, your Whoops, Apple Watches. And there are a few parameters that are extremely useful when it comes to those things. Resting heart rate, early morning resting heart rate, respiratory rate, and duration of sleep. I don't think these devices are great yet at actually analyzing sleep as such. They're not an EEG, but they're pretty good and they're pretty consistent. That's what's really important about these things. And so you can get a lot of data with a questionnaire and wearable data, right? But if you're a serious athlete, and I classify that as someone who makes a living competing, or competing is really important to them, that they actually push really hard for 4 to 5 times a week, right? The other person that fits into the genre is the corporate athlete, because you have the same lifestyle. You are traveling, you are competing, you are stressed about, your business, you have to leave your family behind, sleeping in different beds, eating different foods, different towns. The lifestyle is exactly the same. So I want to use this series to introduce you to the concept of biomarkers and how I use them. And let's start with a question I get asked by a lot of athletes and coaches. Do I step on the gas or do I ease off? Very simple question. But to put it in context, this is typically an athlete who's come to a crossroad. They've been training super hard. They've got a lot of results, right? They saw a lot of gains. And now they've come to a plateau. And they are not sure, like, do I have more in the tank? Do I step even harder? Or do I back off and see that if I put in strategically rest and recovery, would I get what I'm looking for, which is super compensation, right? That's the question we need to ask. And so in those circumstances, I look to biomarkers more than the questionnaire, more than wearable data, because these are some of the most competitive, fine-tuned athletes. And if you are one of them, then biomarkers really give you an in-depth insight in what's going on internally and whether you can absorb training or, it gives you an in-depth insight into your physiological state, gives you an in-depth insight on your internal environment. Is it one that can absorb training or one that can't, right? And so we use biomarkers to identify where you are and guide you through the process to answer that question. Should I be stepping on the gas and training even harder, or is it time to back her off and taper, right? So let's start off by looking at this topic of training and periodization. If you look at this graph, this is a graph that I've used many times. So this concept of main adaptation cycle. The reason we train, the reason we lift weights, the reason we push ourselves is to give the body a stimulus or a stress, right? And that stress, if done in the right amount, tells the body, hey, you need to adapt because this is not going anywhere. And if you don't, you're going to break. And so that is a very systematic, structured way of stressing the body. That's what training is, to allow you to adapt to the stimulus. That stimulus may be sprinting, maybe running long distances, maybe plyometrics, high intensity work, or maybe lifting, right? Any variety of those things. So what most coaches do is they put together a program based on adaptation cycle, all right? And if you look at this graph here, okay, this is Professor Hans Sellier's work. Amazing man. What he showed was when you stress an organism, right, whether that stress is an infection, whether that stress is travel, whether that stress is heat, cold, or training, the body responds with a very predictable response, okay? And there are stages to this. So when you introduce a stress, initially you will notice a drop in performance, and then you adapt, okay? And then you plateau, and then you actually start coming down, and if done correctly, you will rebound, and this point here is higher than where you started. And that's the whole point of training. This point, this jump from here to here is called super compensation. And every athlete adapts and compensates and super compensates in their own way. So you have to know the athlete you're dealing with. Now, if you look at the bigger picture over a career of an athlete, they start off here. This could be an off-season, this could be a career, but let's look at this very simply, okay? They start a off-season training program, okay? At that point, performance actually drops, okay? So if you look at this, this is readiness to perform. Performance actually drops. Why is that? Because this is a new stimulus that you need some time to adapt to. And so once you get through the stage where you've started to adapt, you'll see performance starting to go up. And that happens for a number of reasons. One is you've put in measures, your body's learning to adapt, your nervous system, your skeletal system, your hormonal system, your immune system, all of those things are adapting to the training load. But most athletes actually become more efficient at the movement or a new skill. And so performance gets better simply by becoming more efficient, and the skill gets better, right? So at this point here, everyone's happy. The coach is happy, the athlete's happy, they're seeing gains, nothing goes wrong. Everyone's happy. And so they keep pushing harder, harder, harder until they get to this point here where we call accommodation. That's the plateau phase. At some point, your body cannot keep, it's adapted enough. And so it reaches a plateau, okay? At that point, this is when I get the call. And people say to me, hey, what do you think I should do? Do I have the capacity to push harder? Because, I don't want to get sick. I don't want to break. But I also feel like I don't want to leave anything in the tank, right? And this is where I use a lot of biomarkers to help me. Because here's what's really critical. look at this graph here, okay? These are, so if you go back to the first graph, you see this phase here, this part here. If I look at this in more detail, then I'm going to look at this, okay? So this is the same thing, okay? You put a stimulus, performance drops, then you start to increase performance, and then you overcompensate or supercompensate, okay? But look what happens, okay? They look at 3 different categories. If the training load was too easy, you come down here and your supercompensation isn't that high, okay? You should be up here, but you've only got up here. You gave up this much. That's leaving too much behind, right? But if you push it too hard, then what happens is you get excessive here. You might get too much fatigue, and you actually get too tired to actually reach supercompensation. But if you train too hard, then what's going to happen is you're going to come down here and you push the gas too much, and the system was too fatigued to actually get supercompensation. The whole idea of all these cycles is to find the right dose, the right stimulus, the right amount, okay, that pushes the system hard enough to get to a point where you reach plateau, and then say, okay, you know what, let's take the foot off the gas, let's put in some rest, recovery, taper, reduce the intensity, the volume, okay, and then get a predictable rebound effect, which is supercompensation, all right? And you can do this, we can talk about mesocycles or microcycles. This could be done once a season, this could be done 3 times a season, this could be done over a course of an entire career, right? So you get the point, right? The question I get asked is, the coaches, the athletes, the trainers, is there more left in the tank? Do I need to keep stepping on the gas? Or is it time to taper and take the foot off the accelerator so that we can put in rest and recovery and more calories perhaps and get that supercompensation? That's what the whole training program is about. It is to get adaptation and then supercompensate, so you end up better than when you started, okay? Now, I'll tell you, having worked with some great coaches can do this without biomarkers. A lot of them. They're very, very good. They can look at the quality of the movement, the speed of movement, the efficiency of the body, and they can tell you pretty much like, hey, this guy's maxed out or this girl's maxed out, time to taper off. But my world, I use biomarkers, right? I'm not that sophisticated. I don't spend enough time in the gym, but my world, I use biomarkers, right? The coaches are excellent at eyeballing something. I'm really good at interpreting data. And together, this day and age, we can come to more precise conclusions. Take the guesswork out. All right, so we looked at what biomarkers are. We looked at how to use biomarkers at which stage of training, right? We looked at the adaptation cycles. So now let's look and say, all right, I want to get biomarkers done, right? So we looked at what biomarkers are, the fact that you can use questionnaires, you can use wearable data to look at different stages of an athletic performance. And then we looked at training cycles, adaptation cycles, to predict, when to taper in order to get a supercompensation, right? So now let's focus on biomarkers themselves. Most doctors, allopathic doctors, MDs, we are trained to look at blood work through the lens of sickness, looking for pathology, not looking for performance. And there is a huge difference, right? First and foremost, you need to be able to interpret that data based on where they are in their training cycles or their competitive season, right? Are they mid-season, end of season? You got to understand their nutrition, their calorie requirement, their supplementation. All of that goes into, including the sleep, into interpreting this data, but through a performance lens. I cannot emphasize this enough, right? If you go to really good, excellent physicians, trained really well in medical school, we are trained to identify disease, right? If you are a serious athlete, you need to be able to look at that data and see how you can gain performance. So two different things need to happen. One of those things is the ranges. Many times the ranges that the labs will provide are based on population data, general population data. When you're a serious athlete, you are a very special pool. Yes, you're human, but the ranges need to be tightened. And again, like I said, I've based my ranges on data I've collected on hundreds of athletes, professional athletes, but also CEOs, serious weekend warriors, right? And I've looked at thousands of markers at different age groups, gender, where they are in their training. And when I look at those things, my ranges get very tight, very different to the lab, right? That's one of the most important things you need to look at when you're looking at biomarkers for performance. The second thing is we don't just look at individual numbers. The numbers, your blood tells a story. It tells me where you are coming from, where you are going, and where you are now, right? In order to understand that story, can't just look at individual numbers. You got to look at numbers, compare them to another number, look at ratios. So there's a whole system, there's a whole art of, just like a trainer, there's an art form in putting that piece of puzzle together. So your blood work tells a story. It tells me where you have come from, where you're going, and where you are now, right? But in order to get that story out, you can't just look at individual numbers. You got to look at that numbers and compare them to another number, look at ratios, put the whole picture together. Just like a really good trainer, they won't just give you 5 exercises. It's a system that they put together to get the outcome, right? Biomarkers are the same way. That's the biggest difference I feel between someone who's a physician trained allopathically and then someone who's looking at blood work through the lens of performance, right? Next, what blood test should you get? Well, if you're trying to answer the question, should I step on the gas harder or back off? I look at a few critical numbers, okay? Here's a few. I'm looking to see how much inflammation there is in the system. Inflammation is, think of that as irritation, okay? How much irritation there is in the system. Now, this is why I said, if you look at it from a performance lens, you're going to look at this concept very differently. If you went and looked at it from a sickness point of view and your inflammatory markers are high, that's not necessarily a good thing, right? But if you're a serious athlete in the, pushing really hard and getting a lot of gains, there is going to be inflammation. We want that because that inflammatory response is the adaptation we are talking about. If you don't have that friction, if you don't have that irritation, the body doesn't have enough stimulus to actually adapt. And as we saw, if the irritation is too light, the supercompensation is low. If it's too much, then we're in trouble, right? You got to find the right balance so that you can actually supercompensate. Inflammatory markers, the most common one out there is CRP, C-reactive protein. It's made by the liver. There are 2 types that you can get. You can get the standard CRP or you can get the high sensitive CRP, which is a little bit more tighter in the range, okay? That is a marker for inflammation. And you need to look at that in the background of where this person is in their training, right? So for instance, for my golfers, when I see inflammatory markers elevated and they are mid-season, not entirely happy, right? May have to intervene because we have another half of the year to go. But if it's towards the end of the season and the inflammatory markers are high, not super high, I don't mean pathologically high, but showing me that they've done the work, then that's acceptable to me. It shows me that this tire has some wear because you put the miles in, right? If similarly, I get the end of the season and I see inflammatory markers are perfect, everyone's happy with that. But I ask the question, did you really push the system hard enough this season, right? And so inflammatory markers, I talked about CRP. This is the most common one. But one is not enough, right? And I'll tell you a story that brought this light to me. So when it comes to inflammation, I said we look at CRP, right? But CRP on its own is not enough for me. And here's why. I was working in the emergency room one day, and this guy comes in and he injected recreational drugs, and he had a huge abscess in his arm. True story, okay? It was red, it was tender, the guy was in pain, it was warm. Clearly, all the cardinal signs of inflammation was right there, right? His CRP was normal. And so I asked my boss, I said, wait, why is the CRP normal? Clearly, that's inflammation going on. And this has been going on for, I remember, like 2 days or something before he came into the hospital, right? And CRP is an inflammatory marker that goes up within hours. It's a very quick marker and stays up elevated. As long as the stimulus is there, it'll stay up as long as it needs to. But even if you treated it and it got completely better, it'll still be up for another like 7 days before it goes down. But his CRP was normal. And my question was, why? And my boss couldn't give me an answer. And so I looked into this, all right? And this is where there's a lot of genetic variability. There are multiple markers of inflammation, okay? Just like I see this with kids all the time. There are some kids who get sick and they have, fever, super high fever. They are hot, you can tell. And then you look in their mouth, the ear, and there's tonsillitis or ear infection, or they have the flu or something like that, right? But they mount a fever, a febrile response. And then there are other kids who have the same thing. They have flu, they may have tonsillitis, they may have ear infection, but they just curl up in the bed and no fever. So when I looked into this, there's a huge genetic element that determines how someone responds to stress, or in this case, infection, right? So I no longer just looked at CRP, because it would be silly of me to look at CRP and say, oh, your CRP is normal, you're not inflamed. Well, what happens if you don't make CRP? You're not somebody who puts up a high CRP if you're inflamed, right? So I look at 5 other markers. Some of the other markers I look at is one of them is called ESR, erythrocyte sedimentation rate. It is also a test for inflammation, but usually chronic inflammation, persistent inflammation, right? Then I look at things like ferritin. I look at albumin. I look at homocysteine. So I don't just look at one marker. Then I take all those results, I put it on the background of where this person is on their travel schedule, where they are in the season, where they are, if it's the off season, they're training, where they are in that framework, right? Now I get a full idea of what's going on. So that's the first biomarker, looking at inflammation. The second group of biomarkers I look at is biomarkers that tell me how much stress there is on the body. Okay, are we putting enough stress, or is the stress too much? One of those biomarkers is looking at testosterone, and the other one is looking at cortisol, but more importantly, looking at them together, the testosterone-cortisol ratio. So inflammation is one group of biomarkers for which I told you HSCRP is very useful. The other group is looking at how much stress is on the system, right? Can I get an idea of how the system is responding, not just through inflammation, but what is the system doing and how much stress that's going on in the system? Is it shutting down? Is it showing signs of fatigue? Like, what's going on, right? And so there is one particular biomarker that I like for this. It's actually not, it's 2 biomarkers, but I look at the ratio, right? Testosterone, which represents the anabolic side of the equation, anabolic meaning building up, getting stronger, and cortisol, also known as a stress hormone, is what's released when you have periods of stress. Cortisol is catabolic, meaning it tends to break muscle down, it tends to mobilize sugar, it tends to burn fat. It's more of breaking down, right? So you can see, if you look at the ratio of the testosterone to cortisol, you can look at the ratio of building up versus breaking down, right? In extreme stressful situations, and this is going back to the hospital situation, right? When they look at patients in ICU, this ratio is often upside down. There's a ton of cortisol, very little test, okay? Clearly, on my athletes, I'm not looking at that, but I'm still looking at the ratio. So if the ratio shows me you're still in anabolic phase and the cortisol is not that high, the stress is not that bad, and I have data points on you, I can look at this and say, you know what? You still have plenty in the tank. Step on it, right? Or if I see the ratio starting to shift, I can say, hey guys, maybe we start putting a taper here before this person gets sick. Because if that cortisol goes up too high, it has an effect on the immune system. Your risk of getting an upper respiratory tract infection and then not being able to train goes up, and that's not worth it, right? So that's one biomarker I look at, that ratio. The other one I look at is the neutrophil. Okay, before we talk, the other one I look at is looking at parts of the white blood count. So when you get a report, you will see, it'll say white blood count, and then it'll break it down. And the white blood count has different components to it. Two components are called the neutrophils and the lymphocytes. And I look at that ratio. Typically, I want the ratio to be about 3-1. But if that narrows, 2-1, 1-1, or even reverses, then chances of you getting sick has gone up. And that's when I'll say, guys, this is not a good time to step on the gas anymore. Now, if I see that before your training season starts, I would actually tell you to put a few things in place but it's reversed. Now, if I see it reversed before you even start, then I'm going to address that through rest, recovery, nutrition, supplementation even, and get it to a point where it's no longer reversed, and then start your training season. And I don't like people starting training when they are already reversed, okay? The other biomarker that I like looking at, components of the white blood count. So this is looking at the immune system, right? The white blood count, you will see in the blood test, it'll say white blood count. And then if you look at the bottom, it'll tell you how the white blood count is broken down. There are like 5 components to it. 2 of those components are the neutrophil count and the lymphocyte count. And I look at that ratio, the neutrophil to lymphocyte ratio. Ideally, I want this ratio to be about 3, right? As the system is stressed, either through training, competition, travel, you'll start seeing it narrow. 2.5-1, 2-1, 1-1. And then in extreme cases, you'll even see it shift, okay? When it's shifted, your risk of getting sick, upper respiratory tract infection, reactivation of viruses goes up, right? Now, many times in my career, I have seen athletes who are about to, just came off the season and they are reversed. And their plan is to put a heavy off-season program together. What I always tell the team is, if you are reversed going into the off-season program, I need to put things in place that are recovery-based to get this unreversed, and then start your program then. You're going to get more out of it then, okay? And then there are other markers looking at performance. We looked at inflammation. We looked at stress in the body. The other good marker that I like to see is, oftentimes, believe it or not, if you don't drink enough during your training phase, if the system is drying up, you are going to have a significant drop in performance, right? And so you can look at the sodium and the potassium. To me, having worked in hospital settings when I've had the privilege of, I have, the hindsight of looking back and saying, actually, you know what? We ran 2 blood tests on the same patient 30 minutes apart, right? Because we can get a finger prick and get the blood test immediately, right? And then we can send one to the lab and then we can compare the two. Now, we looked at inflammation. We looked at stress in the body. There's one other component that, I think tells a lot. That's looking at the hydration status of the athlete. If I see signs of the athlete being underhydrated, then fatigue is invariably going to come in and you haven't maximized this situation, right? And so there are many markers, like sodium is a very good marker for acute dehydration, but it changes. Sodium and potassium, typically you go to the lab, you get your bloods done, or somebody comes to your house, they draw the bloods, they send it off the lab. It takes about 5 days before you get the labs back, okay? And to interpret that 5 days later is not great, because when I work in the hospital, I have the privilege, especially when you work in ICU, you may be drawing bloods, every hour on some people. You may be doing blood tests. I've seen blood tests on the same person 2 hours apart, and I can see the sodium has changed a little bit, the potassium has changed a little bit. That affects something called the anion gap, and it's I don't rely on it. I rather look at something called albumin, which has it's a protein that the liver makes that stays around in the body. Each molecule stays for about 28 days. If your albumin levels, okay, that marker will tell me if you've been hydrating adequately, not just for yesterday or today, over a period of about a month. Okay? So if I look at that system and that system shows that we haven't been adequately hydrating, well, maybe the plateau came a little bit sooner. So that's another marker that I look at. So we looked at biomarkers for inflammation. We looked at biomarkers for stress on the system. We looked at biomarkers for whether or not the system is adequately hydrated. Okay. There are a few other biomarkers that you can look at. One is looking at cortisol itself, but it's better to look at cortisol as a rhythm over 24 hours. And particularly you want to see a low morning cortisol or a high evening cortisol, which can tell me that, there may be an underlying infection going on, which may not be obvious, right? It also tells me, especially my baseball guys, like it tells me a lot on how well they're doing when they're traveling east and west, right? The other marker that, is often not talked about is a biomarker that I use is a finger prick test. It's called looking at the redox potential. You might be starting to hear about this a little bit more. This is looking, again, at how much rust there is in the system. As you say, if the system is starting to rust, then perhaps you need to back off or intervene with changes in your diet, right? Then there are markers that you can look at, micronutrients, looking at whether or not you're getting enough calories, a whole variety of markers. But typically, I look at those markers to tell me whether or not I should tell this person to keep stepping on the gas or backing off. The other biomarker I use is something that many people may not have heard of. It's called the redox potential. Effectively, as your system, you're putting more through the system, there are free radicals that are generated. And if you ever cut an apple, see it turn brown, that is called oxidative stress, right? It's like rust. It's like metal rusting. So we can measure that with something called redox potential. And you can guide your training based on that. And I do that with a finger prick test. Other than that, you can look at biomarkers to see whether you're getting enough calories or micronutrients or macronutrients. But to answer the question, should I step on the gas or back off? Those are the biomarkers I start with. Now, the last thing I want to look at is sometimes people say to me, well, how often should I get tested? Well, it depends on what is it you're trying to answer. If you're trying to answer, how much stress there is on the system, you can do this every week if you want, right? Because the numbers will fluctuate. But if you're looking at something that is based on the red blood cell, for instance, like a classic one is looking at the omega-3 index, okay? How much fish oil do you need? Are you dosing correctly? Well, that's measured on the red blood cell. And the red blood cell has a lifespan of 120 days, roughly, right? So if you repeat that test before 120 days, you probably won't get an accurate answer. It's better to wait about 3 to 4 months and then repeat the test. So ideally, at a bare minimum, I'd like to see biomarkers at the start of the season. I like to see biomarkers mid-season, which is probably about the 4 to 5 month mark. And then I like to see biomarkers at the end of the season, right? These are based like full set of biomarkers. And then just before you go in training, I want to look and make sure your vitamin D status is good. We want to make sure your neutrophil lymphocyte ratio hasn't reversed. We want to make sure, what CRP are we starting at? Looking at, where's your cortisol? Where's your testosterone? What's that ratio looking like? So I'll do some biomarkers before we put in an off-season training. And then I use biomarkers during the training to monitor the training. So I hope this has been useful. So I hope you found this useful. Biomarkers are for any athlete that's serious, whether you're a corporate athlete or professional athlete or a weekend warrior. If you're putting your body through a serious amount of stress and want to be guided exactly on trying to get the best outcome, I think biomarkers are amazing. Do you absolutely need to do it? No. As I mentioned, you can have questionnaires, you can have wearable data to look at. I use biomarkers. Biomarkers that I typically use to answer the question, should I be training harder or backing off? I look at the inflammatory response. And again, I don't just look at the CRP, I look at 5 other markers. And then I look at how much stress there is on the system, right? We talked about the testosterone cortisol ratio. And we also looked at the neutrophil lymphocyte ratio. And then I looked and said, is the system hydrated? And we looked at the albumin for that. This is a fraction of all the tests that we can do, right? But it's enough to get you going. I hope you enjoyed this. I had a great time talking to all of you, and I'll speak to you soon.